setting, in Indian scenario?
Sir, in Indian scenario, the most common cause would be tubercular pathology.
So did
That
you
is the
send
second.
for CBNAT?
Yes, sir, we sent for CBNAT. It came out to be negative, and the histopath also showed no evidence of granuloma. So we concluded it to be primary, that is the idiopathic type of cocoon.
So, coming to the same question, one thing I just want to know, you planned the patient for an emergency surgery. The patient shows clinical improvement and you go ahead with the elective surgery. Normally in a patient of intestinal obstruction, he responds to conservative treatment, we continue with the conservative treatment. So what made you to subject the patient to laparoscopy?
So the reason that made us go for a diagnostic lab was because in the past 1 year, almost she had 3 to 4 recurrent episodes of the same, and she was repeatedly undergoing conservative management. So we had to get to a final conclusion. That is the reason we decided to go for a diagnostic laparoscopy instead of managing it conservatively further.
Second thing I want to know, the patient has undergone a lap appendicectomy 9 months back.
Yes.
And in that period, there was no mention of the cocoon.
No, sir.
Then after 9-10 months, you get an abdominal cocoon. So what are the possible causes? You said there is no definite cause. There has to be a cause. So what are the different causes which has led to development of cocoon in these 9 months? Possible causes.
Yes, sir. A, it could have been a little initially, which was missed on lap appendix.
No.
Second, it could also be after post-operative changes of the laparoscopic appendectomy. So after any surgical procedure, we can see adhesions and the reaction of the tissue to the procedure. So due to that, it could have happened.
Before taking the patient for diagnostic lab, you did go for a CCT abdomen.
Yes.
What was did the symptoms improve after ingestion of 1 liter or 2 liter of contrast?
Yes, sir, it did. Not exactly after, but the next day morning it improved and she started passing flatus.
So that clearly mandates that you should not go for exploration.
We should not go for exploration, yes, sir. But because she had recurrent episodes in the past 1 year and it was not being solved, we decided to take her for diagnostic laparoscopy. Only when we saw the adhesions and the cocoon, we decided to do it therapy.
Sagittal section is very important in our setup, in this setup. Why not the coronal section? Why not the transverse section? Why sagittal section?
Sir, all of them are important, but in this case, because we were able to see all the surrounding structures and its connections, like it was abutting the urinary bladder below, it was very clearly visible on the sagittal section.
Can you see them on coronal section or axial section?
Yeah, we can, sir, but very peculiarly visible.
I think you got carried away with that image.
Thank you.
Thank you, sir.
Noticing the differences.